What should you eat on the day of your weekly Mounjaro injection? On injection day, opt for light, easily digestible meals, lean proteins, whole grain carbohydrates, and non-starchy vegetables, whilst avoiding high fat, fried, or heavily processed foods. Are you taking Mounjaro and wondering whether what you eat on injection day actually matters? It really does, and making the right food choices may help you feel more comfortable week to week. Mounjaro works partly by slowing down how quickly food leaves your stomach. That means the wrong meal on injection day can make an already sensitive digestive system feel a whole lot worse. So let's break down what tends to work and what to avoid. Mounjaro, which contains tirzepatide, is a once-weekly injection licensed in the UK for type 2 diabetes and in eligible adults for weight management in those living with obesity or overweight with weight-related health conditions. It works by mimicking two hormones, GIP and GLP-1, that your body naturally produces to regulate blood sugar and appetite. One of its key effects is slowing gastric emptying, which is exactly why food choices on injection day matter so much. The most well-tolerated foods tend to be light and easy to digest. Think lean proteins like chicken, fish, eggs, or low-fat dairy. Whole grain carbohydrates, oats, brown rice, or wholemeal bread are generally a good choice. And non-starchy vegetables like courgette, spinach, cucumber, or green beans tend to sit well. These are gentle on the digestive system and less likely to trigger nausea, bloating, or abdominal discomfort. On the other hand, there are foods worth steering clear of around injection day. High-fat meals, fried foods, heavily processed snacks, and sugary foods can all worsen gastrointestinal side effects. Because Mounjaro already slows digestion, a heavy or greasy meal can leave you feeling uncomfortable for hours. It's also worth being mindful of alcohol, which can further irritate the digestive system and affect blood sugar levels. When it comes to how you eat, smaller and more frequent meals tend to work better than large ones. Eating slowly and chewing thoroughly can help manage common side effects like nausea and bloating. Staying well hydrated throughout the day is also important, especially as constipation is a side effect some people experience. There are a couple of things worth discussing with your doctor or pharmacist. Because Mounjaro slows gastric emptying, it can affect how quickly your body absorbs other oral medications, including the contraceptive pill. If you use oral contraceptives, you may need additional contraception, such as a barrier method, for 4 weeks after starting Mounjaro and for 4 weeks after each dose increase. Your healthcare professional can advise you on what's right for your situation. It's also worth knowing that Mounjaro is not recommended during pregnancy or breastfeeding. If you're planning a pregnancy or think you might be pregnant, speak to your doctor as soon as possible. Now, when should you seek urgent medical advice? If you develop severe, persistent abdominal pain, especially pain that spreads to your back, with or without vomiting, seek urgent medical help, as this could be a sign of pancreatitis. Also, contact a healthcare professional promptly if you experience persistent vomiting, signs of dehydration, or any symptoms that feel unusual or worrying. Don't try to manage these symptoms through diet changes alone. And as always, your prescribed dose and any adjustments to your treatment should only ever be made under the guidance of your doctor. Never change your dose on your own. So to recap, on Mounjaro injection day, keep meals light and easily digestible, based around lean proteins, whole grains, and non-starchy vegetables. Avoid heavy, fatty, or processed foods that can worsen side effects. And if anything feels seriously off, especially severe abdominal pain or persistent vomiting, reach out to a healthcare professional straight away. This video is for general information only and doesn't replace personalized medical advice. Always follow your prescribers and pharmacist's guidance. Have you found any particular foods that help on injection day? Drop a comment below. It might really help someone else in the community. If you found this useful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.